Hello, and welcome to this presentation on Attention Deficit Hyperactivity Disorder, or more commonly known as ADHD. So, what is ADHD? The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, defines it as a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development. ADHD begins in childhood but persists into adulthood. There are 3 different types of ADHD: inattentive type, hyperactive impulsive type, and combined type. Inattentive type shows symptoms like struggling to stay focused, being disorganized, wandering off tasks, or lacking persistence in completing tasks. These are the kids in class who are sitting there listening to the lecture and doodling on their paper, trying to wonder maybe what they're going to have for dinner tonight, what's going on afterward. Hey, I don't think I've noticed that thing on the wall before. The hyperactive impulsive type are going to deal with symptoms like difficulty with delaying gratification, inappropriate excessive motor activity, and fidgeting. These are going to be the kids who are going to be struggling to just stay in their seat, possibly like kicking the person in front of them, fidgeting all the time, messing with everything that's near them, having to get up in the middle of class, or doing homework. The combined type deals with symptoms of both of those who both can't focus but also can't sit still in a more typical manner. Diagnostic criteria, as defined by the DSM-5. The first set of criteria is a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development, as characterized by inattention. 6 or more of the following symptoms have persisted for at least 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social and academic occupational activities. For older adolescents and adults, age 17 and up, at least 5 symptoms are required. Symptoms are: often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities. Often has difficulty sustaining attention in tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. Often has difficulty organizing tasks and activities. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. Often loses things necessary for tasks or activities. Is often easily distracted by extraneous stimuli. Is often forgetful in daily activities. Hyperactivity and impulsive symptoms. 6 or more of the following symptoms have presented for at least 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social, academic, occupational activities. For older adolescents, 17 and up, at least 5 symptoms are required. Symptoms are: often fidgets with or taps hand or feet and squirms in seat. Often leaves seat in situations where remaining in seat is expected. Often runs around or climbs in situations where it is inappropriate. Often unable to play or engage in leisure activities quietly. Is often on the go, acting as if driven by a motor. Often talks excessively. Often blurts out an answer before a question has been completed. Often has difficulty waiting his or her turn. Often interrupts or intrudes on others. The rest of the diagnostic criteria are as follows. Several inattentive or hyperactive impulsive symptoms were present prior to the age of 12 years old. Several inattentive or hyperactive impulsive symptoms are present in 2 or more settings. There is clear evidence that symptoms interfere with or reduce the quality of social, academic, or occupational functioning. The symptoms do not occur exclusively during the course of schizophrenia or another psychotic disorder and are not better explained by other mental disorders. Current understanding. ADHD is a disorder that involves hyperactive, impulsive, or inattentive behaviors starting in childhood. ADHD is not just a childhood disorder. It is not just something that people grow out of. Adults have ADHD too. Sometimes mild delays in language, motor, or social development, low frustration tolerance, and irritability often occur with ADHD, even though they are not official symptoms. ADHD is much more common in kids who have a parent with this disorder and is likely genetic. ADHD is diagnosed more in boys and is likely to go undiagnosed in girls. There is a 2-to-1 ratio about boys to girls being diagnosed with this disorder. This may be because girls more typically present the inattentive type, which is more likely to fly under the radar than the hyperactive type. You're more likely to think the guy who's not able to sit in his seat during the second grade class lecture is the one who has ADHD than the girl who you can't tell is not paying attention to you. History. ADHD was first noticed in children in the 19th century. It was listed as hyperkinetic reaction of childhood in the DSM-2, which primarily focused on the hyperactive impulsive symptoms. Changes in the DSM-3. The DSM-3 recognized the inattentive symptoms that were also part of ADHD. The disorder was renamed Attention Deficit Disorder with or without Hyperactivity, which was abbreviated to ADD or ADD-H. The name changed to ADHD and the DSM-3 revised. The DSM-3 revised went back to focusing on hyperactivity, though it also allowed adults to be diagnosed as long as symptoms first appeared during childhood. The DSM-4 distinguished between hyperactive, impulsive, inattentive, and combined types of ADHD and separated them into different lists for diagnosis. The DSM-5 increased the age of symptom onset from before the age of 7 to before the age of 12. Treatment. The first kind of treatment is behavioral therapy. There are 3 kinds that I read about. The first one is parent training. Parent training trains parents in different ways to parent to be able to better help their child and better help them navigate their symptoms and their daily life. The second kind is classroom management. Classroom management helps the child figure out how to improve their behavior in a classroom setting and often involves daily report cards being sent back. The third kind is peer interventions. This deals with social skills training and adults mediating interactions between different kids. Behavioral therapy is often prioritized in children, as sending a bunch of kids on medication doesn't always sound the best, and if the condition can be treated without medication, that is the kind of treatment that should be pushed forward first. The other way that ADHD can be treated is through medication. The most popular kind of medication are stimulants because they're the most effective at treating ADHD. Some of the most popular ones are Ritalin, Adderall, and Procentra. Non-stimulants also can be used to treat. They're less effective than stimulants. Strattera and alpha-2 receptors are encouraged if the patient doesn't want to take stimulants, whether it's for family reasons or due to a comorbid condition that they have. Antidepressants, antipsychotics, and mood stabilizers are also sometimes used, though they are not FDA approved. These are more often used when other medications are ineffective or not working, or to treat with a comorbid condition that also requires these medications. Conclusion. ADHD is more than just can't focus or can't sit still disorder. There are 3 main types of ADHD: inattentive, hyperactive impulsive, and combined type. ADHD starts in childhood but continues throughout adulthood. ADHD was first introduced in the DSM-2, but diagnostic criteria and name have both been changed a lot since then. ADHD can be treated with therapy, medication, or both. I hope you enjoyed this presentation, and here are my references.